This is Dr. Debbie Wallace. Welcome to Health in the News, Hits News, brought to you by 360 HBN and True Health Institute. Today we're talking about the 10 most popular COVID-19 myths of 2020. There are many myths or false beliefs about COVID-19. The most comical yet dangerous myth is that putting bleach in your body will somehow fight COVID-19. Just because the president said it does not make it true. Truth is that you can kill the virus on any surface with bleach or any detergent for that matter. It is not the same when the virus gets inside your body. But if our bodies are in proper working condition, our immune system is able to fight the virus once it's inside. Putting any toxin, including bleach or alcohol, will only depress our immune system, so it worsens our body's ability to defend itself. Viruses can't live outside a body host, so that is why we can destroy it on surface and if we just stop spreading the virus by wearing masks. Other countries have popular myths. For example, a popular myth in Nigeria is that if you can hold your breath for at least 10 seconds, you don't have the virus. This is not true. Popular in Korea is if you drink hot water or eat spicy foods, it will kill the virus. Not true. In South America and some islands, myth is that bananas can cure COVID-19. This is not true, although eating more fruits and vegetables will help improve your immune system. But bananas are not a cure for COVID-19. So here in the United States, we did a survey of the top 10 myths, and here are the results. Number 10 myth, COVID-19 is not a virus, but it's because of 5G technology that people are getting sick. Truth is that when you look at the map that shows where 5G is located, many places with 5G technology have very few cases of COVID-19. Therefore, this is not true. That does not mean that 5G technology doesn't have its own health problems, but it is not the cause of COVID-19. Myth number 9, COVID-19 will be here today and gone tomorrow. Truth is, we keep underestimating this disease, which is why we have over 350,000 people have died in the United States and over 1 million deaths worldwide. Myth number 8, we should wait until there is a lot of cases of COVID-19 to practice wearing masks. Even though Dr. Fauci said this at the beginning, he's corrected himself since, because you don't want to wait to practice prevention. That makes no sense. We would have been able to control the spread of this virus better if we had practiced prevention earlier on. We would have saved thousands of lives. Even now, prevention, especially wearing a mask, he has said and others, it is the best way to stop the spread of this virus, because wearing masks prevents others from getting the disease. Myth number 7, achieving herd immunity is a good idea. Truth is, you would have to kill millions before herd immunity would be achieved, so that's not a good solution to this problem. Myth number 6, COVID-19 is only killing older people in their 90s that were going to die soon anyhow. Not true. Children not only get the disease, can also transmit it, even though they may be asymptomatic. Some children have also died from COVID-19, and many middle-aged people have died who would have lived a much longer life without COVID-19. Myth number 5, COVID-19 is a hoax perpetrated by liberals or politicians. This is a worldwide pandemic affecting many different nations. Over 20 million people in the United States have been infected with COVID-19 and many more worldwide. This is a real disease. It is not a hoax. Myth number 4, COVID-19 is like the flu. Truth is, COVID-19 is nothing like the flu and has killed a lot more people. The flu didn't kill doctors and caretakers, nurses and others that are just providing care for patients like COVID-19 has. We've consistently underestimated COVID-19, but it is a SARS virus like the Ebola virus, which was far more deadly, killing about 50% of those infected with COVID-19. COVID-19 is only killed in comparison 2 to 5%. Do you remember the Ebola virus? Do you know how we developed a vaccine for Ebola? No, you probably don't, because we controlled Ebola with prevention. Only 2 people in the United States died of the Ebola virus because we prevented the spread of this SARS virus. So we didn't kill COVID-19, a kitten, but we killed the lion, Ebola. Understand that 2% of the US population dying would mean over 6 million American deaths. Myth number 3, vaccines will make COVID-19 disappear after 2020. Truth is that the vaccines are not 100% effective. Nothing is. That means that if you have a vaccine that's only about 95% effective, as most are, then 5 in 100 people vaccinated is not effective and could continue the spread of this virus. Secondly, children under 16 will not be allowed to get the vaccine, and they can get the virus and can spread the virus. Thirdly, it is a virus, so there are mutations, and we don't know that the vaccines will protect against every mutation. We hope it will, but unfortunately, we may need new vaccines every year to combat COVID-19. We don't know. So vaccines alone will not stop COVID-19. We will still need to practice prevention. Myth number 2, shutting down everything again would destroy our economy. Truth is that continuing half-open businesses will prolong this disease and prolong our return to the pre-COVID-19 state. Currently, there are several countries around the world that have achieved status of no more COVID-19 infections. We stopped another SARS virus, the Ebola virus, by prevention. So it is possible. But with so many people believing that shutting down is not effective, it is not likely to happen. It wasn't effective the way we did it back in March of 2020. However, it's because it was half done. Half doing prevention never works. The fact is that shutting down everything completely, businesses and schools, churches, everything for just 1 month, along with testing and contact tracing, could bring this disease under control and help recover our economy much, much more quickly. Myth number 1. Wearing a mask is unhealthy because you will die from carbon dioxide you will breathe in. Simply not true. Truth is that face masks are merely filters and doesn't harm our bodies. Furthermore, there is an ongoing live experiment of many doctors all around the world that have to wear masks for many, many hours in ICUs in direct contact with patients with COVID-19. This has proven that wearing masks is not unhealthy, but is life-saving. Prevention is the best way to stop COVID-19. So please, wear your mask, social distance, wash your hands in 2019. Because with or without the vaccine, we will need this to stop the spread of COVID-19. This is Dr. Debbie Wallace. Thank you for watching Health in the News, Hits News. See you next time.